Hey, everybody, this is Eric Mishi, SAVE Executive Director, Suicide Awareness Voices of Education. And we are here with another conversation that is part of our entire week of conversations about suicide prevention, suicide awareness, and different topic areas with different folks who are involved in this subject matter space. We've had a lot of fascinating conversations, great content, folks who are out there doing incredible work on a local, state, and national level. And today, I'm thrilled to be able to have a conversation with Monica McConkey to talk about the challenges that we're facing in rural communities as we start to see record increases in mental illness and suicide rates and things like that. And this is a timely topic because whether you live in Minnesota, you live anywhere else in the country, rural healthcare and the impact of the rural community on all of us is something. It doesn't matter where you live in this country, this affects all of us. So Monica, it's great to have you here with us today.
Thank you. Happy to be here.
So let's start off by having folks learn a little bit more about you and the work you've been doing.
Sure. Yeah. So I'm from a small community in northwestern Minnesota called Bijou. I don't know if anybody's heard of Bijou. We're about, I don't know, I guess you could say 80 miles east and a little north of Fargo, North Dakota, just to put perspective there. But grew up on a farm, all about rural, all about farming, helping on the farm. Family still farms. In fact, my son is the fifth generation on our family farm, so he works with my brother and parents. After school, I went to college, got degrees in psychology and counseling, and ever since I have worked in the behavioral health field, primarily really in rural areas of Minnesota and North Dakota for almost 30 years, which seems just unbelievable to look at my career and see that it's been 30 years of work. So currently, I have a private practice called Eyes on the Horizon Consulting. I provide direct service counseling primarily to farmers and ranchers and their families in Minnesota and some coaching consulting to families outside of Minnesota. I'm a QPR trainer. I'm a Safe Talk trainer. So I do a number of initiatives and work with a number of agencies to do QPR and Safe Talk, including the National Farmer Veteran Coalition. They received a SAMHSA grant, so I'm doing QPR trainings with those folks on we do like 3 a month through Farmer Veteran Coalition. I also facilitate a monthly virtual farm suicide loss group. So these are folks that have lost someone close to them to suicide, and they are somehow connected to the agricultural community. So that's kind of in a brief nutshell who I am and what I do.
That's a lot of work in the last several decades. I grew up, I spent about 7 years in a small town in North Dakota called Fairmount. I don't know how big the population was in your town, but Fairmount had about 400 people.
Oh, I think we were at 98. So
we were a big town.
We were big.
We were a big town. One of the things I recall, and it's been 40 years since I lived in Fairmount, North Dakota, but Fairmount, North Dakota was really my first kind of interaction with the issue of suicide. My then 16-year-old friend, Alan, died by suicide. And this was 45 years ago. His family were farmers.
Yep.
And 45 years ago, you never talked about suicide. You didn't talk about mental illness. You didn't talk about feelings. You didn't talk about any of these kind of things. And, 45 years ago, the farm economy was probably a little better than the farm economy may be today, or at least a little different. So let's talk a little bit about that, because the data and the statistics that are coming out increasingly show that there is a crisis in rural America as it relates to suicide and mental illness. And what is it you want people who are not from the rural part of the country to understand about what's taking place in rural America, particularly as it relates to those that are in the agricultural economy?
Yeah. There's a lot happening. You know, when you talk rural in general, we can easily identify barriers to access for mental health help, just in terms of there's a lack of workforce, there are underserved areas, we don't have a lot of specialty care, people are geographically isolated, which of course can translate very easily into social isolation, which we know drives one of the drivers of uh, hopelessness, and increases your depressive symptoms if you're already feeling depressed and you're isolating. So all of those factors. In rural areas, many people are self-employed. So there's a health insurance issue when we look at accessing services. We still have rural areas that broadband is not adequate enough to access services online. So I know, especially during COVID, we were pushed into being really creative, which was actually kind of a blessing to many of our rural areas to bring services in. But we can't lose sight that I have farms where I have to drive 2 hours to the farm to meet with them because it's hard to even do a phone call without the call dropping, much less try to do a Zoom. So all of those issues impact rural. And when we talk farm community, you know, there are unique stressors that just add to the impact of stress. And those are things like the uncontrollables, weather, commodity prices, interest rates, that I know farmers who, you know, right now we're in a very down ag economy, and it's kind of looking like it's going to be down for a few years. And so, you know, there's going to be increased risk when we look at suicide. And I know many producers who know they are going to work all year very hard and at the cost of relationships and finances and physical health, and they will not make any money.
Yeah.
And they know that in January, heading into the year.
Yeah.
And so it is, I guess, if there's anything, especially from an ag-related standpoint, that I would love people to understand are those stressors that are beyond what you see when you see the equipment and the acres and the assets, that there's so much underlying that is really impactful to producers and their families.
Yeah, you know, I was having a conversation yesterday with a friend of mine who is a farmer who has a family farm that they actually have someone else managing right now. And he was sharing with me, you know, the current commodity prices, current prices for cattle and things like that. And when you think about the razor thin margins that farmers operate under, right? And you know, depending on where you live in this country, where you farm, you know, in the Midwest, we had a lot of rain this spring, right?
Yes.
But other places where that's not the problem. The problem is not enough rain. And so the kind of the unequal application, if you will, of these stressors may be different in different parts of the country, but they are all relatively the same in that, you know, you're dealing with a profession that is difficult to predict, that the factors there are really challenging. But then you're also dealing with some other factors which we know are not necessarily unique to the subject matter space of suicide. You're dealing with a economy where it's still relatively male dominated.
Yes.
Where you're also dealing in situations where you look at access to firearms. 56% of suicides in this country are with a firearm. And you mentioned a couple of things that are extraordinarily important. I want to talk about that a little bit more, because this again underscores some of the risk factors, which is the distance between where you can get access to mental health care and the lack of, I mean, we talk a lot about, you know, boy, wasn't this great having telehealth?
Yes.
Well, telehealth is great if you have a cell phone connection,
Yes.
or if you got broadband.
Yes.
So as you have these conversations with folks, how critically important are those resources to be able to make sure that people can actually get access to those resources?
Oh gosh, it's so important, and it goes even beyond mental health. It's just that connection piece to other things. Can I log on and view a webinar? Can I do FaceTime with family and friends? So it's critical to connection, and we know that in-person connection, of course, is much more valuable even than online connection, but it's still something. Also, I think we need to not overlook that the population in rural is aging. And so the average age of farmers is right around 60. Technology is difficult for some of those folks. They didn't grow up with it. It's changing all the time. And so that's a disconnect as well. When I say, like, I just talked to a farmer yesterday, and he lives quite a distance from me, so it really needs to be Zoom or phone. And I said, well, can we schedule a time to do a Zoom? And he's like, I have no idea how to do that. And so I was like, that's okay. We can talk on the phone, and if we want to switch to Zoom, I'll talk you through it. It's okay. I've had another elderly female farmer who has had her in-home mental health helper set up Zoom. And so without support, some of our folks just wouldn't even pursue. And so that is an issue. Stigma is another issue. It still exists. I think it's getting better. We're talking about it more. Ag industry has picked up the message, and they have campaigns and initiatives around stress and resilience and suicide awareness. And I think that's helping a lot because it's just becoming an open part of our conversation.
Yeah. And, again, we could spend a lot of time talking about statistics and those kind of things. But as you do the work that you do, and for anybody who may be watching or listening to this, who is a farmer or out in the ag community, what are some of the things that you're talking with people about to make sure that they understand that there's help out there and that there's resources out there?
Well, anytime I can get in front of an audience of behavioral health folks or rural healthcare providers, that's a great audience to share that the program in Minnesota exists. And there's something typically in every state. If you kind of search farm stress in your state, there will typically be something. Often it's run through extension. We in Minnesota are extremely blessed. Because the legislature funds my position and Ted Matthews, who is the counselor in the southern part of the state. So farmers can access us at no cost. And we, either go to them, or if distance is an issue, it's Zoom or phone calls. So I am completely accessible with no barriers.
Mm-hmm.
So it's a service that is the envy of other states, put it that way. So I feel blessed to do the work. But when I work with farmers, the number one call, in all honesty, that I get is around relationships. And I don't get the call saying commodity prices are low and I'm really stressing. That may happen, but the vast majority are, my world is falling apart. And at the core of that, my relationships are falling apart. And all of those stressors we talked about are what is underneath that drive.
Yeah.
And so that leads to often lots of conflict and chaos, elevated emotion, isolation, increased drinking, all of those risk factors. And then it just tends to spiral out of control. So when I do meet with farmers, one of the things we work on first is let's just try to calm the emotion, get our rational brains turned back on, and let's start to look at these issues from a problem-solving approach. Let's talk it through. we can get there. We can make change happen. And then, I spend a lot of time just on there thinking, is your thinking helping you? Is it not helping you? And many times it's not helping. It's easy to fall into that when there's all these stressors. And for farmers, especially with so many things being out of their control, we do talk a lot on we have to focus on the things that you have control over. So that's kind of in a nutshell the approach I take when I'm out there.
Yeah. Well, this issue of loneliness, right? The U.S. Surgeon General has called it a public health crisis.
Yeah.
And when you're dealing with loneliness and you've got little access to people to talk to,
Yep.
helplessness sets in, and all of these things kind of set in. So, as you talk to policymakers, what are the types of things that you're encouraging them to be looking at to try to address this issue? Because I would say that right now, if you're in the ag economy or you're tangential to that ag economy or the rural community, you may be aware of this, right? But if you're living in a metropolitan area and you're a metropolitan policymaker or somebody like that, this may not even be on your radar screen.
Yeah.
So what are the conversations that you're having with policymakers, saying to them, hey, you got to wake up and pay attention here. We got ourselves a public health crisis going on.
Right. Well, I think, very simple is we've got to, just like we did with rural electric and rural telephone, we've got to get adequate broadband throughout our rural regions. And, cell phone service, we need that connectivity to be out there for our people. There are some good initiatives around bringing healthcare and mental health care workforce into rural with some, debt forgiveness and things like that. I think that's important to continue. I think we need to, we are so blessed in Minnesota because there's so many good things happening already. We have farm advocates that are funded by the legislature that really come alongside our farmers in times of distress. We have the ag mental health program. We have the mediator program. And I guess my hope would be that those remain funded, over the course of time, that we don't act in a reactive manner when crop prices are low and farmer suicides spike again. Like let's keep it steady and stable so those services are there in a preventative capacity, not just a reactionary capacity. So those are all important. There's been a movement which is going to be interesting to kind of develop, and I'm involved in some initiatives around this, in peer-to-peer interactions among producers. So farmers that have male, female, that are willing to be that peer mentor. What are the opportunities there for us to increase access to support in a way that doesn't exist now? So I think it'll be kind of interesting to see that develop and maybe even have a hand in developing that and see what we can do with that in much the same way they utilize peers in mental health and addiction in other avenues.
So one of the things that we talk a lot about this in suicide prevention is reducing access to lethal means, right? Yep. Having this conversation about how do we, not take away people's guns,
Yep.
How do we address this issue of lethal means safety?
Yep.
And when you're dealing with a population that firearms is simply second nature, it's part of the lived experience in rural communities and certainly on the farm.
Yep.
But we also talk about lethal means safety having to do with pesticides and right, and so it's not just firearms, so that nobody thinks that that's the only thing, because when you're dealing with agriculture, you're dealing with dangerous chemicals and pesticides. And it's a profession where injuries occur, and where injuries occur, and sometimes you find yourself self-medicating, and we know that substance abuse also has a direct impact on suicidal ideation and increases impulsivity.
Yeah.
So how do we have these conversations? And again, we kind of come back to this issue of stigma. How do we have these conversations about lethal means safety in a population in which people aren't really comfortable having those conversations, and yet by not having those conversations, we're increasing risk factors exponentially with these populations?
Yes. Oh, such a good question. Such a difficult topic in our rural communities, right? I'm a firearm owner. My family has firearms. I mean, it is deeply embedded in rural culture and in agriculture. You know, for whatever reason, they may not even be hunters. They may just keep them around for, you know, animals that are injured or coyotes that are killing their sheep or whatever. Um, so, you know, I have been on farms and encountered this exact issue where someone is at risk. And, you know, the way I approach it, because many times it keeps people from seeking help and being vulnerable because there's that fear that somebody's going to take my guns away. I'm going to lose great grandpa's, you know, shotgun. I'm never going to get it back. And so, you know, my message to them is all about when we're in distress, when we're not doing well, our thinking brain is turned off.
Yeah.
And so we want to protect you during this time to keep you safe. And doesn't mean your guns are going to be taken away, but maybe one of your spouse or one of your adult kids or a friend changes the combo on your gun safe. Maybe the guns go to their house and they'll keep them for you. You know, I just try to make it very practical. Like, this is not really about the guns. This is like why we don't want drunk people driving cars, because their judgment is not where it should be.
Right.
And so this is all about us being concerned about you, caring about you, and wanting to keep you safe.
Yeah.
And like not being alone. Like, you know, I'm gonna be riding in the tractor with you for a while, or, you know, I'm gonna be coming and family member coming and staying with you through the night, or, you know, I think I'll go spraying with you and just ride along and make sure you're okay, or touch base on the phone, or, you know, it's all about sharing that concern and care. And we're really working on eliminating any risk that might be in front of you.
And I think that part that you just mentioned, Monica, is really important. This idea that, one, our goal here isn't to take away something meaningful from anybody, right? But in addition to that, it's that idea of maintaining that connection, right? Yes. I think one of the conversations that we have constantly with folks who are concerned that a loved one may be experiencing suicidal ideation, they're concerned about their access to lethal means, and it's this notion that you can't leave people alone, right? That you have to maintain that connection, because that suicidal ideation, that crisis that's involved there, it isn't as though it passes and then it's over with, right?
Yeah.
There needs to be that kind of sense of vigilance that, you know, we need to continue to stay engaged. We've got to continue to ask questions. We've got to listen. You know, we've got to be able to follow up with that individual and that family member or that coworker or colleague, because the idea that, you know, all too often that, you know, somebody said, you know what, I'm fine. And then you walk away from that and you find out, you know what, that conversation needs to continue.
Yeah.
And so as we think about giving information and empowering friends and families and colleagues in rural communities, what are some of the best pieces of advice you can give to folks who may be in a situation where somebody they care about may have expressed suicidal thoughts, may have expressed concerns about their own safety. What are some of the types of advice and tools that you might share with them as to how to
Yeah.
be helpful in this situation?
I guess one thing I would say is, seek help for you, for them. Don't shoulder this all on your own. Where can you go? What number can you call or text? We've got 988 that you can call or text. We've got in Minnesota, we have a farm helpline. It's not a suicide, but it's a crisis 24/7 Minnesota Farm and Rural Helpline, and they will answer calls for people in crisis or if they're suicidal. So if nothing else, access that help and support to help guide you in your next steps, not knowing what to do. Because when we're alone in it and a person is in crisis and we're trying, they don't want to get help, or they're being, difficult and irrational. That is so hard. It's so hard to know what to do, and don't do nothing, I guess, is the message. Do something. It's good you're there with them. It's good that you're being present. You also need to be sure you're keeping yourself safe, and bring in, who else can you bring in? Pastor, faith community leader, other friends, family. Don't be alone in it, I guess, would be my advice to folks. Utilize 988, utilize the helplines. If they're willing to go see their primary care provider, go see the primary care provider, but involve other helping resources.
Yeah. Well, calling or texting 988, critically important message that we've been communicating all week. We'll continue to do that throughout the month. It's free, it's confidential, it's 24/7, 365. And so it's a resource, and the people that are on the other end of that call have been trained to talk to folks who may be in crisis or just need someone to talk to. And sometimes that's really all we need, is somebody to talk to.
Yep.
And, and so kind of as we close out this 30 minutes, which has gone by quickly, and again, on a subject matter that we need to continue to raise awareness about kind of what's going on in rural communities throughout the entire country.
Yep.
We want to always try to end these conversations with a message of hope to folks that may be listening or watching, and make sure that people understand that there is hope, even though it sometimes feels like that there isn't any. So as we kind of end this, what kind of message of hope would you offer to folks in rural communities that you think is important for them to hear?
Gosh, I love that you end like that, because we do tend to, we talk about the risk factors, we talk about the problems and the statistics, but rural is a wonderful place to be. It is a wonderful place to raise kids. It is a wonderful place to grow up, and focusing on the blessings and the things in our lives that we have to be thankful for is really key. And there's so much, but when we tend to see so much of the negative, and we hear so much of the negative, and the political divide, and all of the, the economy, it is easy to let that be the big part of our thinking. It takes over our mental and emotional time, and we don't have to allow it to. Let's really focus on what we love in life, who we have in life, what we enjoy, and make that the big part of what we think about and what we feel.
Those are good words to end by, and powerful, hopeful message for all of us, regardless whether we live in rural communities or metro communities. Thank you for the work that you're doing. It's obviously important and necessary. Thank you for joining us today. I suspect we will talk again in the future as we continue to try to raise awareness around this issue and this particular population in our country.
Great. Thank you so much. I look forward to it.
Thanks, Monica. Have a great day.
Bye-bye.